and reconstructive surgeon. We're here with Sharon today. Sharon, how are you doing, dear?
Fine.
Sharon is going to be doing some of the Bellafill, and we're going to do the Bellafill for tops of the cheeks, a little bit in the marionette lines, and then we're going to be doing upper eyelid and a lift. So I'm going to zoom in for you so you can see a little bit better about what we're doing here. So Sharon, can you tell us why was it that you wanted to do a cosmetic treatment? What was it that inspired you to have something done?
Mostly my neck. I inherited all this extra skin here.
Okay.
And that's the most of it. But
And so I'm going to show your pictures here where you can see this is her neck and jawline that we're going to tighten up, and we're also going to do some fillers in those areas as well. So very good. So you've come to the right place. Did you have a chance to look at our book, Sharon?
yes.
Let me set this over here. What did you think about the book?
Well, I was impressed. I was impressed by the outcomes of many of them that I saw. So,
Very good.
and all I have heard is you're the best. So that's why I'm here.
Well, of course that's true. You know, you get the hang of it after a few thousand. So we hold your trust in very high regard. We're going to do a great job for you. So what I'm going to do now is I'm going to do a cleanse to the skin. We're going to be doing some facial fillers. I use all of the facial fillers, but today we're using the Bellafill. So this is some Hibiclens here that we're using to cleanse right across. And I'm going to set the back of the chair up just a little bit here. There we go. Is that okay for you like that?
Not really.
Let me, you want me to move
It's too far up.
too far up? Let me lay you back a little bit and gotta make sure. And then let me put the headrest a little far forward so that way. Now rest your head back. Is that okay for you like that?
Yes.
Okay, good. Very good. So we're gonna use some of the Hibiclens here. And then I use the lidocaine, 1% lidocaine with 1 to 100,000 epinephrine. Now, did you tell your friends, Sharon, what you were doing today?
No.
Are they going to get upset if we make you look younger than they do?
Yes. I told a couple.
So now I'm using the lidocaine, 1% lidocaine with 1 to 100,000 epinephrine. So you'll feel a buzz, and then you feel a pinch here, 1, 2, 3, pinch. You feel big pinch, little pinch, medium pinch. Not too bad?
Not too bad.
Does that buzzer help a little bit?
Yeah, the vibration.
The buzz distracts. The brain can only focus on so many things at one
Ouch.
time. That's a little more sensitive area. Now here you're going to feel buzz and then pinch, 1, 2, 3, pinch. So I just do a little spot in the skin. Okay, now let's give her a little break there. Tell me what you're feeling right now.
Now nothing, but when
Okay.
you were doing
When
it.
I was there. All right. Can you plug that for me, please? Just unplug it and scoot it forward. That's perfect. Thank you. Now you'll feel 1, 2, 3, pinch, little pinch. Okay, let's take a little break. You doing okay? So we're not in a hurry. When you do little pinches like this, then it makes it much easier. 1, 2, 3, pinch. Sorry, a little tender there. Thank you for your comments. Thank you for your shares. We're in Tampa, Florida, and in the Villages, Florida. You can look us up at ImageLift.com. For those of you just joining in, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're doing Bellafill and an office-based procedure facelift today, ImageLift facelift. Sharon, how you doing, dear?
Good.
So once you numb in those areas now, she'll feel very little or not at all, maybe just some pressure. And so what I do is I like to start in the cheek, and then I just take a 27 gauge needle. There it is, a little 27. Okay, and then now, Sharon, do you feel a little bit of a pinch right there? A little pinch or not really?
Little.
So she feels a little bit. So we make that's the insertion point where I'm going to place the cannula. Then this is a 27 gauge cannula right here, and then this is the Bellafill. There's the Bellafill, okay? And that's the cannula, and you can see it's got these little gradations, and it's soft on the top. Okay, so it's not sharp. Hello, Brian, thanks for joining in. So then I just insert right through, and I use this twist motion to get the cannula where we want it. You might feel a little pinch there, Sharon. You doing okay?
Yes.
So the cannula is inserted. I know the cannula tip's right about here. Then I use the shiver technique when I inject. The shiver technique allows very small amounts of the filler to come out because you're alternating the pressure, putting high, low pressure on the plunger and doing a very even, fine distribution of the filler. So right there I did about 0.1, almost 0.15 of filler, 0.15 cc's. So then I thread up a little bit. If I want to do a little withdrawal, I'm not in a vessel, but it's hard to get in a vessel anyways, with the cannula. Everything's looking good. Thank you for joining in. Thank you for shares. If you're on iPhone, you can swipe left or right and share with your Twitter, Facebook, or Periscope friends, or follow us at ImageLift. At ImageLift is our new Periscope name. We changed from Rich Castellano. Now it's at ImageLift. Thank you for the hearts. Thank you for the shares. So now we're just building the top of the cheek. We lose volume as we get older. Someone says, how much? How much what? How much are you looking for? Sharon, how are you feeling, dear?
Fine.
Everything's looking good. You're gonna love it. Now, how did you hear about us originally, Sharon?
I was just, I think, going online and just checking different ones out, and I had gone to a couple others, and I wasn't as pleased as when I came here.
What was it that you did? Don't mention any names, but what was it that you didn't feel comfortable with when you did your other consultations?
They didn't really inform me of what's going to happen, what to expect. It was more like, this is what it costs, and I didn't. Your office was much more informative.
Good.
So that's why I chose this office.
Well, thank you very much for choosing us, and we have such an amazing team. I'm so proud of our team, Nina and Charlene and Elise, our clinical team, and we also have Euphemia and Nina and Mindy and Stephanie and Ginger and Thomas, and Jen was here today.
Wow.
And
how many?
Dana's here. We have 12 or 13 now. So we built up in the cheek. Open your eyes for me, and you can see it's a little less hollow, a little more hollow here. So we're building up those areas now, and I'm going to take away some of that little white mark, and you'll feel a little numbness in the top of your cheek, okay? So you can see we've gotten that to soften a little bit. Make a big smile for me, big smile. Now relax as best you can. Hello from Brussels. So those of you tuning in, please let us know where you're tuning in from, and please do share. We've done over 500 live broadcasts on Periscope. We've had hundreds of thousands of views from all around the world. We're in Tampa, Florida, and in the Villages, Florida. Look us up at ImageLift.com, and you can also look us up on Amazon. Now, do you feel a little bit of a pinch here? A little pinch there. How about here? A little pinch? Not so bad there? Okay. Perfect. Everything's looking good. Turn your head just a little bit this way. That's perfect.
How long is this Bellafill supposed to?
So the Bellafill, the collagen gets absorbed and replaced by your body's own collagen, but the filler itself, the PMMA, is not absorbed. It is non-absorbable, if you use the FDA's words. So you feel a little pinch here. A little pressure, a little pinch, a little pressure, pinch. So then I use the same technique. Now I know the cannula is right about there, and then I just use the shiver technique to deliver some of the filler, shiver for the deliver. And if you have a tremor, you can just tell your patient you use the shiver technique, and then they don't know the difference. Now, we're filling in where that valley is. This is more the top of the cheek. We lose bone as we get older, and we get a little shorter. And we lose bony prominences on the face, the cheek, the temple, the cheek, the back of the jaw, and the chin. And so now we're just putting things back where they already were.
Someone asked before if insurance covers this.
The only insurance that we accept is a Visa, MasterCard, and American Express. So no, this is not for insurance. This is cosmetic, and sometimes an insurance plan may cover cosmetic procedures, but usually not. So I'm injecting, and I'm also feeling with my other finger where the cannulas. Thank you for watching. Thank you for the hearts, and thank you for the shares. Hello, Jen. Good to see you. Thanks for joining in. So we did some of the Bellafill filler treatment there. Now I'm going to do a little bit more to the marionette line. Sharon, how are you feeling, dear?
Fine.
Everything's looking good. So for this area, I like to use the needle for some of the smile lines because I'm going to thicken the skin, okay? And you can use the fillers deep to reinflate, or you use it right in the substance of the skin. Let me turn your head this way just a little bit. Perfect.
Someone
So
says,
now,
so there's no diagnosis you can make up so my insurance could cover this?
right, so I always recommend that you tell the truth so I don't make things up. So the answer to that is no. So I'm injecting right into the crease here. A little pinch. And you can see that crease just kind of fills in a little bit. Now, a part of that is when we do the lift, it's going to lift it up some. And there's a few little creases here, a little pinch. So I'm just thickening in the skin right here. Okay, so that's half the syringe there, about 0.5 cc's. Thank you for the hearts. Thank you for the shares. If you're on iPhone, please swipe left or right on Periscope and share with your followers. A little pinch. Or if you're on Android, you swipe up or down. Your friends are going to get upset if you tell them you are watching a live procedure. We're doing a live facelift procedure for Sharon. And if you didn't share with them, they're going to get upset when they find out you were watching. Pinch. Feel a little pinch there, Sharon?
Yes.
Not too bad?
No.
You're tough. We try and make it easier than getting a tattoo. Everything's looking good. So we're filling in some of the creases. Thank you for the hearts and thank you for the shares. Please, a lot of shares and hearts for Sharon. She was so kind to allow us to teach using her treatment. And again, a big thanks to my team for setting everything up perfectly. I feel so well taken care of. We have such a wonderful team. I'm very, very proud of our team. So, for those of you just joining, I'm Dr. Rich Castellano.
How much younger do you think I look?
We're getting here.
Younger.
Mm-hmm.
1 week at a time, 1 month at a time, we're turning back the hands of time. I'm going to put just a little bit left in through here. Now, we're going to rebroadcast because we're going to set things up for her procedure. We're going to do the upper eyelids, and we're going to do the lift under local anesthesia. So I'll show you one more time. Perfect. Now, if you look at those smile lines, and just take a look and then compare them. This is fillers only.
Mm-hmm.
So with the fillers alone, you can see how those areas in the smile lines, look how deep the creases are here. Okay, you see how deep those creases are. And with fillers alone, and look under the eyes as well, you can see that we've got those to soften quite a bit under the eyes. Now we're going to do the neck and the jawline, so congratulations. You're looking
Thank you.
good. That wasn't too bad, was it?
No, it wasn't.
All right, Periscope, Facebook, and YouTube, we will see you all soon. Thank you all for joining in, and we'll be right back.